The Journal of International Orthopedics reports that obesity increases the likelihood of a total knee or total hip replacement surgery in pre-senior adults. Scientists reviewed medical charts of patients aged 18 to 59 years old who underwent either a total knee replacement or total hip replacement from January 2002 to December 2004. Of the 204 patients studied, 52% had a total knee replacement, while 48% had a total hip replacement. Obesity was a significant factor associated with the need for surgery when comparing the study group to adults of similar age in the general population. The specialists at Florida Hospital Waterman's Joint Replacement Center explain how extra weight means extra pressure on your joints.
Well, obesity does put a lot of stress on your joints, whether it's the hips or the knees, and we're seeing a lot of patients that are overweight needing joints at an earlier age. Also, of course, if they have an injury at a younger age, that predisposes them to developing arthritis in that joint at an earlier age.
Well, arthritis can be crippling, disabling, depressing, especially when it's involving the weight-bearing joints. There's nothing worse than not being able to be active. When it gets to the point where somebody cannot go down to the end of their driveway to pick up the mail, or they even can't get from their bedroom to the kitchen, let alone go out and exercise, go to the movie, take that trip. When it gets to that point, that their activities has been so much decreased, their lifestyle has been altered so much, they really need to consider having some kind of joint replacement to get that fixed. The problem is, the more arthritis you get, the more pain you can get. Pain or instability. And I might add that some patients, even though they have bad arthritis in a joint, they may not be hurting that much. They're born with a high pain threshold, but they have a knee that's unstable. So then the concern becomes, okay, are they going to be walking down the sidewalk, the knee gives way, and they fall and break their hip? So the two things that you get concerned about is pain and instability. But having said that, if their lifestyle is being altered to that degree, what typically happens is they become less and less active. As they become less and less active, of course, they're sitting and riding instead of walking, standing. The rest of their body gets in worse shape, not just the rest of the joints and their musculoskeletal system, but their cardiovascular system, everything starts to get worse. As they get more and more out of shape, they're doing less and less still, so it becomes a catch-22. And then, of course, the emotional part comes in. They start getting down in the dumps, they start getting bummed out, they start getting depressed. Their spouse starts getting depressed, because the spouse is going to do things and they're sitting here and they can't do things. So it just becomes a very bad downward spiral, physically and emotionally.
Trying to stay fit, not being overweight. Exercise is good. Keep the muscles healthy around the joint to support the joint better. And as with anything else, a good, healthy diet will sort of help you in that respect.
Researchers at the American College of Rheumatology found that for each pound of body weight loss, there is a 4-pound reduction in knee joint stress among overweight and obese people with osteoarthritis of the knee. To learn more about the innovative techniques and procedures at Florida Hospital Waterman's Joint Replacement Center, check out the Obesity and Joint Health Story icon on yourhometownhealth.com.